Well, I'm very, very pleased, especially with the work that you just learned about that the Advisory Council put together for the city of Wilmington. We were very pleased by the CDC coming and looking at the impact of gun violence from a public health perspective, especially the trauma that's associated with this level of violence, and then creating for us, from a science-based perspective, what they call is the predictability model, which what it means is they could look at the indicators of those who had already perpetrated gun violence and said, what do they all have in common? And then they gave us some common characteristics of these individuals. And what we learned was that many of these individuals actually who had been expelled, suspended from school, had issues within the school system, many of which were part of the Child Protective Services organization. Many actually had been hurt themselves through levels of assault as victims, not necessarily as perpetrators. So now that we had those indicators, we started saying, how do we actually prevent this? How do we intervene? Maybe when we see one indicator, how do we start directing our services in a more deliberate way to those individuals in order to prevent this level of violence that's occurring, not only to others, but to those individuals themselves. Somebody on the advisory committee would say, hurt people actually hurt people. So we do know when we think of it as a public health disease, that we do know that people can recover from disease, we can treat disease. So when you think of it from that mindset, that really then gave us, kind of that menu. Then we went out and looked at what are best practices, what are evidence-based practices that are really getting good outcomes. What we learned is that we do have good programs, but many times they're very fragmented, and many times they're short-term, that they're not staying for the long duration, especially if someone's at a high risk, for this level of trauma. So we want to kind of redirect how we do this service, and we want to do it across all government. Not only the agencies in government like education, health and social services, and the children's department, but also across the Newcastle County government, who also has programs supporting children and youth, the city, who also has programs supporting children and youth. How do we combine our resources in a more effective, deliberate way, especially for those at highest risk?